Welcome to the Big Sky Care Connect Health Information Exchange user training. My name is Jeanette Polachek, and I'm one of the clinical consultants on the Big Sky team. BSCC is a nonprofit organization that is tasked with the implementation and operation of Montana's state health-wide information exchange. The project is funded in part through a contract with the Department of Public Health and Human Services, but statements herein do not necessarily reflect the opinion of that department. Let's begin with a success story reported to us by Dr. Arbogast from Billings Clinic. A 53-year-old patient presented at SCL Health Medical Group in Red Lodge with dyspnea. That same day, the patient was seen at Beartooth Billings Clinic ED and diagnosed with COVID. Within 2 weeks, the patient was admitted to St. Vincent's with respiratory failure and then moved to Advanced Care Hospital of Montana. When the patient started seizing, Dr. Arbogast, who is a neurologist, was brought in to consult. Dr. Arbogast reviewed the HCL discharge summary and Billings Clinic ED note and found no evidence of seizure activity. However, when he logged into BSCC, he did find a past prescription of Keppra, an anticonvulsant medication that had been prescribed by a Riverstone provider. Dr. Arbogast restarted the medication and the seizure activity was controlled. This scenario illustrates how having access to the complete patient history, no matter where the patient presents, can positively impact patient care outcomes and prevent unnecessary or repetitive testing. This is the agenda for today's session. This training is designed to help you get the most out of your health information exchange experience. At the end of this session, I will also share a link to the BSCC website that has the user manual that can be used for future reference. There are numerous studies documenting the benefits of health information exchange. Healthcare facilities that participate in their state or regional HIEs have realized better patient outcomes through reductions in readmission rates, decreases in duplicative services, increases in revenue from better documentation, and cost savings from avoiding adverse events. This slide provides an overview of the BSCC technology footprint. Let's start with the data we send and receive. We are connected to healthcare facilities of all types across Montana. They send us clinical data on the patients they see. Collective Medical is a solution used by emergency departments sending ED alerts as patients are admitted. Dr. First provides comprehensive patient medication data, including fill history. eHealth Exchange, which is a network of networks, connects federal agencies and non-federal healthcare organizations. Through this connection, we share data with health information exchanges of North and South Montana, and work is underway for connections to Utah, Colorado, Wyoming, and Idaho. We recently backloaded 3 years worth of Medicaid claims data, and now we receive data on a daily basis. All of this data is housed in the BSCC Clinical Data Repository. Users access this repository in one of 3 ways: via the BSCC Secure Web Portal, or using single sign-on technology that enables access through your electronic medical record. This option provides access with just one click from within the patient's EMR record. The third option is through direct query, where data is automatically retrieved from the HIE and loaded into your EMR. BSCC is able to generate notifications of significant patient events such as ED visits and hospital admissions for any users that sign up for this service. BSCC recently purchased Health Catalyst, which is a data analytics solution. With this tool, BSCC is implementing population health dashboards, clinical quality metrics, and key performance indicators. In terms of what's coming next, BSCC signed a contract with Medicom, who is an image exchange vendor. This solution will allow us to link the actual image with the radiology reports we currently receive. We are also building partnerships with additional payers and are in discussions with both Blue Cross Blue Shield and Pacific Source. This is a list of all the organizations that have signed participants agreements with Big Sky. The list represents over 300 locations. The bolded ones are sharing data with BSCC and represent more than 200 locations. The ones with asterisks have also signed up for ED alert services through Collective Medical. This map provides a visual representation of the organizations across Montana that are contributing data to BSCC. An interactive version of this map is available on the BSCC website, and the link is shown under the map. The right side of the slide lists all the data types found within the BSCC patient record. This is a list of browsers that are supported for each of the most common operating systems. You can see that Windows supports the widest range of browsers. The granting authority from your facility has completed an authorized user agreement for your access to BSCC. You should have received a welcome email from BSCC with your user account, temporary password, and a link to the BSCC login page. The temporary password is valid for 7 days. If you are unable to activate your account within these 7 days, then contact the BSCC help desk and they can issue a new one. Contact information can be found on the BSCC website. Once you have entered your credentials, you will be prompted to change your password. Enter your username and temporary password from your welcome email. Temporary password goes into the old password field, then enter your new password. Passwords must be at least 12 characters and include at least 3 of the following: 1 lowercase letter, 1 uppercase letter, 1 number, and 1 symbol. Enter your new password again to confirm password and then click submit. You should receive a confirmation that the password was successfully changed. Close this window and use your new password to log into BSCC. Now let's move on to the demonstration portion of this session. I'll be conducting this demonstration in our live environment so you can see exactly how the solution works. But the patient record we review is completely made up. No actual patient data will be displayed. We'll start the demo on the BSCC login screen. But before I begin, let's review what's displayed on this page. Just below the login area, you will find important system-wide announcements such as when new data feeds have recently gone live. Below that announcement is information on how to contact the help desk. And the section below summarizes your responsibilities as a user accessing BSCC patient information. I'm using my BSCC user account to log into the portal. But as stated before, there are other ways to gain access. One way we strongly encourage you to investigate is connecting to BSCC automatically through your electronic medical record using the single sign-on technology that was previously mentioned. Further information about this technology can be found on the BSCC website. For this demonstration, I am logging in as a clinician who has full access to the patient record, including sensitive data. We also have user roles for clinicians with limited access, support staff, and payers. Once I log on, I land on the patient search screen. Patient search allows users to find patients in 2 ways, using a medical record number and the associated facility, or by patient name. When searching by patient name, it is best to add additional demographic information such as date of birth or address to narrow my search results. The minimum search criteria when searching by patient name is at least 3 characters of the first name and 3 characters of the last name, or at least 1 character of the last name and the date of birth. Date of birth can be selected using this calendar widget, or you can type in the date of birth using a 2-digit for month and date and 4 digits for year format. I'm going to search by medical record number and associated facility. And so I'm putting in my facility and I'm putting in my medical record number. And I click search. Once I enter the search criteria and click search, the patient results screen is displayed with my results. Because I searched on MRN, I get an exact match. You can see the weighted match is scored 1,000, indicating an exact match. If the message "no match is found" was displayed, then the solution was not able to find a patient matching the MRN and facility combination I entered. If I had searched by patient name, the search results would return a list of possible matches sorted in order of probable match. Patient name is a phonetic search, so your search results may display close name matches based on algorithms that account for common misspellings. If the system times out as it's searching, that means I need to refine my search to narrow the possible matches. Now, before I open the patient's record, I take note of the message. Some records have been filtered due to consent. This message indicates that the patient's record contains 42 CFR data, and I need to break the privacy seal in order for this information to display when the record is opened. Users who do not have sensitive data access will not see this warning and cannot break the seal. To do that, I use this back to patient search breadcrumb located in the top left corner of the screen. Notice my search criteria is still displayed. To break the privacy seal, I check this override box and then enter the required information. If I am not getting authorization directly from the patient, I can enter who that person is. I can also enter a reason. I will put in patient care. And the type of authorization, I'm going to say verbal. And this information I enter here is captured into an audit log and is included in the reports that we send to your facility's privacy officer. Once I enter the required information, I click search and come back to the patient search results screen. Notice the consent message does not display anymore. One other feature to note before opening the record is if I click on this arrow, I am shown the complete list of all the medical record numbers associated with this patient and icons indicating what data is available in each record. I can click on any icon and a legend appears indicating a description for each of the icons. For David, we see his record contains most all of the data types you will find in a BSCC patient record. Okay, let's open the patient's record by clicking the top entry. Be sure to click the top one to open the full record. If you click on any of the individual MRN line items, then the record will just display data from that facility. If the patient's record contains lots of data, you will see a green line advancing along the top of the screen with a message stating awaiting results from Flash or Dr. First. Once the message changes to done, click the refresh link to refresh the screen. This response should only take a few seconds. If you do encounter lengthy wait times, please give the help desk a quick call or send them a message. The Big Sky patient record is laid out in a format that is similar to a typical electronic medical record. The header contains basic demographic information, and in this case, a banner is displayed containing information on 42 CFR data usage and is displayed only because I broke the privacy seal. There are icons displayed on the far right indicating additional information about the patient. You can click on any icon to view the list of icons and their descriptions. In this case, I see the patient has allergies and some additional information on demographics. The legend also provides quick shortcuts to corresponding sections of the record. For example, I can get to the patient's allergy by clicking on this link. And this is the list of allergies for this patient. To get back, I click on the Back to Chart Book breadcrumb located here. If I click on the ellipses at the top right corner, the list of key patient demographics is displayed. This also takes us to the patient summary page, and we will cover that feature shortly. Notice there is a sensitive data button. Because I am a clinician with sensitive data access, I can use this button to break the privacy seal on data that is protected under Montana law. This law covers all HIV and STD information. I enter the same information as before, and once accepted, this data is displayed in the patient record. Notice too, the banner now displays additional wording about Montana law. Users who do not have sensitive data access will not see this banner or the button when they open the patient's record. One final note about sensitive data before we move on. BSCC defines a third set of patient data as confidential. Confidential data is sent from non-42 CFR facilities and includes substance abuse disorder, mental and behavioral health, reproductive health, and social abuse data. Users do not have to break a privacy seal to view confidential data. Their access is granted based on their user role. Along the left side of the screen is what's called the chart navigation tool. You can quickly navigate to any section of the record by clicking on the section name. The blue bar next to any section indicates that data is available in that section. The record opens to the clinical summary. The clinical summary contains 6 sections that display the 5 most recent entries for each data type: diagnoses, lab results, allergies, diagnostics, medications, and documents. You can use this section to get a quick overview of the latest information on this patient. Within each section, you can sort by different options depending on the data type by clicking on the sort option icon located in the upper right corner of each section. And anytime you see an ellipses At the end of any line, you can click on that to view additional information about that data point. Once you are done reviewing the clinical summary, you can minimize it within the chart book menu to have better access to the rest of the record. Each of the sections is laid out a similar way. Let's take a look at medications. There are two subsections, current and historic medications. A current medication is defined as any medication that has been prescribed or refilled within the last 90 days. Within each section, I can search using this free text search field, and I can sort using these sort options. For example, with historic medications, I can do a primary sort on medication and then do a secondary sort on date to get a good indication of the fill history for a particular medication. Again, anytime I see the ellipses, I can click to display additional information about this prescription. I can see the ordering provider, the pharmacy, and the SIG associated with this prescription. I use the Back to Breadcrumb button in the top left corner to navigate back to the main section. As of January 2022, BSCC has started receiving claims data from Medicaid. We extract only clinically relevant data to display in the patient record, and that includes medications, diagnoses, procedures, and services. Let's take a look at diagnoses. You can see that there are filters at the top of the section to allow me to see only the data from clinical sources, only the data from claims, and all of the data. And we have the same filters for procedures and services. We receive a variety of clinical documents from participating organizations. Most of these documents can be found under Documents. You see a list of available documents and a link to the full report. We currently receive a variety of transcribed documents, such as visit notes and discharge summary, as well as continuity of care documents from participating organization. BSCC also receives imaging reports from several facilities. They are located under Diagnostic Studies. Again, I see a list of available reports and a link to the full document. As mentioned earlier, BSCC has just signed with an imaging exchange vendor. Once the solution is implemented, we will link the images with their corresponding reports. Lab results are presented in two different views. I find the view by date, this top view, to be the easiest to navigate. I have the list of lab results and the dates and times of available tests. I can click on the date and time to get the full details of that test. And when I have more than one result, I can click on this big C to get a cumulative view. And I can also click on this graph link to plot the values for a visual representation. Now, to get quickly back to the main page, I can use Select Chart Book from this drop-down menu on the breadcrumb button, and that brings us back to where we started. Vital signs are presented in a table format along with some pre-configured graphs. BSCC also receives immunization data and patient histories. So this is immunizations. And then under histories, we have information as well. And the list of encounters includes inpatient admissions, ED visits, and outpatient appointments. And there is a section on demographics. Coming very soon, BSCC will also display Medicaid eligibility data. The last section I'll cover is the patient summary report. We get there by clicking on the ellipses in the top right corner of the screen and then clicking Access Summary. This section is used to generate a summary that includes most of the data contained in the BSCC patient record. I say mostly because some sections of the record are not included, clinical documents being one major example. The summary can be viewed in a variety of formats, and I have the option to generate a basic summary or an expanded version that includes some additional sections, such as a list of clinical documents we have for this patient. But it is just a list. The contents of each report are not included. If you have direct secure message linked to your BSCC account, then you are able to send the summary to any colleague with a DSM account. If you don't, you can still download the summary and then send via whatever secure messaging platform you use. Either way, I have the ability to customize the report. For example, I can limit the data included to just the past year and select only the last few encounters to make the report much more manageable to read. Let's review a couple of other features before we can conclude this demonstration. I use the icons on the left to navigate to these sections. The magnifying glass takes me back to patient search. My list allows me to create and maintain a list of patients I want to track. Use this Add Patient icon to add patients to the list and click the ellipses to remove a patient from the list. If I have a DSM account attached to my BSCC account, then I click on the envelope to send and receive my messages. If I want to change my password, I click on my user name and select Profile. From this screen, I can change my password and set my challenge question and answer. If this challenge question and answer are set, then I can utilize the Forgot Password link located on the logon page. To log out of the system, I again click on my username and select Log Out. That concludes the demonstration for this session. Let's review a couple of more slides before we finish. If you need a new temporary password or your account is locked or the Forgot Password function is not working for you, please contact the BSCC Help Desk. The Help Desk is available 24 hours a day. The contact information is listed at the bottom of the screen and can also be found on the BSCC website. A final note about your responsibility when accessing patient information in BSCC. Like your EMR and facility policies, users are expected to use and access records and data within BSCC in a manner compliant with HIPAA and BSCC policy. All user activity is logged, audited, and reported to your facility. For instance, users generally are not allowed to access their own records or records of family members if not for legitimate treatment purposes or as otherwise allowed by HIPAA. Any suspicious activity is subject to further investigation, and unauthorized use or access of the system may result in fines or penalties imposed by law. Training materials can be found on the BSCC website under For Partners. Also, the patient I used for this demonstration, David BSCC Train, is available to any user who wishes to explore. Thanks again for taking the time to learn about BSCC. We look forward to working with you and providing the best possible care for all Montanans.